So today we have a very interesting combination procedure. I'm doing an ultra petite BBL, a silicone above the muscle breast augmentation, and rib remodeling. So our patient is very small. She's about 5'2", 103 pounds with a very, very low BMI. So what are our goals today? Well, she wants a very natural implant. So we're going to use a Motiva teardrop implant, which is the ergonomics, and we're using the lowest profile, also known as mini. She has some breast asymmetry, so we're gonna go with 2 different sizes, probably in the range of around 200 to 220 cc's. The goal will be to augment her breasts, which she's had some kids, and so we want to restore that volume that she's lost, but nothing that's going to be high profile or overly projected or anything that looks super obvious. So it's going to look super, super natural when it's done. As far as the lipo, I'm going to do my signature Lipo 400 and lipo for arms. So we're really going to try to remove as much fat as we safely can from her abdomen, her sides, her back, and her arms, and then we're going to transfer that mainly to her butt just for a little more pop and just a little tiny bit in the hips. And so last but not least on this combination procedure is we're going to do anterior and posterior rib remodeling. So a lot of patients tend to have a boxy frame. Even if they were to have no fat at all, they still have a very boxy frame, and people ask, well, why are they boxy? Genetically, your ribs may be just as wide as your hips, your ribs may be just as wide as your shoulders, and if that's the case, you're going to have a boxy frame. With my signature rib lux procedure, we're aiming to address those lower floating ribs and then the ribs right above them, the false ribs, and we're aiming to bring those in a couple of inches. The way I do that is through a tiny needle point incision where I go in and I create a small fracture of the rib, and that brings the waist in slowly over time with a corset. So in patients who are very boxy, even though they have a low BMI or they're good candidates for the ultra petite BBL, sometimes they need that little bit of extra help to really get that narrow waist. Are we ready for a timeout? Our patient today has no known drug allergies. It's a 27-year-old female. She's 5'3", 102 pounds with a BMI of 18. She's here for a silicone breast augmentation with Motiva implants above the muscle. Vaser, Lipo 400, Lipo for arms, BBL with anterior and posterior rib remodeling. The SCDs are on and confirmed to be working. Underbody and overbody warmer is on, correct?
Correct.
TXA and NSAID.
We're given 1 minute after arrival.
Any anesthesia concern?
No anesthesia concerns.
Any nursing concerns?
No.
We're currently supplying. We'll start supplying, then we'll finish from. So whenever I'm doing breast aug, patient comfort is very important, so I always inject a long-acting pain medicine. I inject around the incision, under the skin, and everywhere where I'm dissecting the breast. That allows for us to do this procedure with minimal discomfort, and most patients don't even need to take narcotics for the breast portion post-op. So our patient today, she's Southeast Asian. Her parents came from the Philippines. A lot of our patients who come from Southeast Asia prefer more of a very lower profile implant or more of a modest look. So we're not doing anything high profile today. We're doing a low profile implant just because she wants something that appears very, very natural. When I put the implants in, I use a special funnel. This funnel allows us to get the implant in through a very small incision without actually touching the implant. I always use a combination of irrigation and antibiotic solution, particularly betadine, before I put the implant in and inside the pocket to help decrease the risk of infection and capsular contraction. So a lot of people think of breast augmentation as a very easy procedure, and I don't look at it that way. I think it's a very complex procedure, and a lot of people take it lightly, whether that be the surgeon or the patient. Failure to plan is essentially planning to fail. So I take a lot of measurements before surgery. That includes measurements such as the base width. It includes measurements from the nipple distance to the fold, assessing the fold differences on either side, assessing the actual volume of the breast tissue. So all this goes into my preoperative planning. Then after that, it becomes a long discussion with the patient as to what exactly are they looking for. Are they looking for a highly augmented look, a minimally augmented look? Then we have to choose between low profile, moderate profile, high profile implants. I think the mistake that a lot of people make is they choose implants that don't fit their body, and that can lead to problems such as the implant bottoming out or falling below the fold. It can lead to implant malposition. It can lead to incisional openings. So there's so many factors that are involved with a breast augmentation. And so, picking a cheap $5,000–$6,000 breast augmentation is not always the right option, although there's often nothing wrong with that. But it's not one of those things that you ever want to get on a budget deal and go to the surgeon who's offering them at the lowest price doing 10 a day, because a lot of those fine details may get missed. So whenever I'm doing a breast augmentation, I always sit the patient up so I can assess symmetry. There's a couple things I'm looking for. I want to make sure that the height of the breast are similar, that I have a very similar fold. I haven't closed yet because I want to make sure that I'm very happy with everything. If I'm not happy, then I'm going to take it out and put a different size implant in. So I used a 200cc low profile teardrop shaped Motiva implant on this side and a 220 on this breast, which was slightly smaller to start. So I always sit up just to assess the symmetry. Am I happy with the cleavage? I haven't over dissected, so we're still gonna have really nice cleavage in the middle without a uniboob or symastia. I'm happy with the way the breast sits here. I'm happy with the width. And so now I'm just gonna sit the patient back and close everything up. So I prefer an incision underneath the breast so it's hidden well in the breast crease fold. The other options are the armpit, which I don't do, or around the nipple, but I prefer the under breast crease fold. It allows me to control how low the implant sits, and it has the lowest risk of capsular contracture. So I prefer a small incision under the fold. This one is just about 2.5 centimeters on that incision. So a common question is, how long does it take to do a breast augmentation? And my answer is, it takes as long as it takes. There's no rewards or awards for finishing super fast. And so I'd rather take my time and get it done right. On average, a breast augmentation takes about an hour. For me, it's usually a little bit more, just because I'm always assessing symmetry. I want to make sure everything's closed correctly, so I never rush the process. I'm often asked, what is my favorite procedure? Well, the answer is the procedure that makes the patient the happiest. But if I had to choose, it's actually a combination. And so it's called my signature Dre Sculpt Bikini Makeover. And that's a combination of Lipo 400, fat transfer of the hips and buttocks with BBL, breast augmentation, and rib remodeling. So that's actually my favorite combination of procedures. There's 4 major things that I need to perform good liposuction. The first one is my tumescent solution, which has pain medicine and epinephrine in it to help decrease bleeding, but also it helps to remove the fat a lot more smoothly. Second thing I need my Vaser. Vaser is a ultrasonic assisted liposuction technique which helps break up the fat from the surrounding tissue, and that allows me to get really nice smooth contours without a bunch of irregularities or lumpy bumpy. The next thing I need my power assisted liposuction. This takes a lot of the work off my wrists, my hands, my shoulders, and allows me to remove fat in a very controlled, safe fashion. And the fourth and the most important thing is I need a good, healthy patient. All right, so we finished the anterior portion of the procedure. So that includes our subfascial breast augmentation and the anterior part of Lipo 400, which includes the anterior axilla, the lateral chest, the upper abdomen, lower abdomen, and the pubic area. Next up, I'll be addressing these anterior ribs with my Riblux procedure. Particularly, you can see from the side how much anterior rib protrusion she has, and the goal will be to decrease that significantly today. So a lot of patients, when they're wearing shirts, they obviously have nice cleavage, they have their breasts, but sometimes the anterior ribs protrude out, and you can actually see those through tight clothing. So with my Riblux procedure, I can address these anterior ribs and help decrease some of that anterior rib flare. Hers is not bad, but it's going to help decrease her under bust, which will help to accentuate her stomach and help to accentuate her new breast dog, but also give her an overall smaller waist. All right, let me just give you a quick demonstration of what happens with rib remodeling. This is a Q-tip. This Q-tip actually bends, very similar to your ribs. They're very moldable and bendable. So your ribs kind of sit like this. This is a device called a piezotome. I use this nice sharp tip that's custom designed right here in Los Angeles. And so I use this to actually cut the rib. It actually irrigates with some solution that has pain medicine and some other medication in there. And so I go on right on the rib, and I just I cut the rib, okay? And then once that's cut sufficiently, I'll just go in and put a little pressure and create a little fracture. That's it. I don't remove the rib, I just create a little bit of fracture. And then by wearing the corset, that's gonna cause that rib to move in, which will then cause your underbust and your waist to become significantly small. So the sound you heard, that was just a monocortical or one-sided fracture of the ribs. I did 3. Probably only heard 2 sounds, which is not uncommon. The last one I really felt, but didn't hear much of the sound. But I've achieved my goals on this side. We'll take an ultrasound and look to make sure the lung is okay, and then we'll move to the other side and do the same thing. All right, so I've done the rib remodeling. Now I'm using the ultrasound to confirm that the lung looks okay. What we're pointing to here on the screen, that's the lung, and it's sliding back and forth under the rib, which is above it. So that's the rib itself, and you see how close the lung is. But now I've made sure that I haven't injured the lung. There's no blood or fluid between those 2 spaces. So I've done it safely on this side. Got a little crunchy action going on, so that's just that monocortical fracture of the anterior ribs here. Same procedures I did on her left side, so that's going to help decrease her overall underbust and decrease her width of her chest. We'll flip over, we'll do the same thing on the back side. We'll address the anterior ribs, and that will be the completion of the rib lux procedure. All right, so with rib remodeling, no huge scars. I never call it scarless, because there's always going to be some break in the skin, but just take a look here. We have very, very tiny little pinpoint incisions. I go in with a tiny little needle, and those will heal just like a freckle. So back in the OR doing an ultrasound guided safe BBL. So what I'm looking at on the ultrasound screen, up here is the skin, and then I have the superficial fat, the deep fat, and then all these striations down here, that's the muscle, okay? When I compress, you can see I'm pushing on the muscle, and so my goal is to keep the fat above the muscle and right under the skin in this fat layer. A common question I hear is, do I need to gain weight for a BBL? And in over 95% of patients, the answer is no. You want to come in at your ideal weight. The reason why is because you can't really get a BBL and then plan to lose 20, 30 pounds. You're going to lose that fat that was transferred. So you always want to come into surgery at your ideal weight. For patients that are really petite, on the other hand, you can often find fat by going to the thighs, the arms, and doing my signature Lipo 400. I rarely ever have someone gain weight unless they have a very low BMI, like maybe 17 to 20. But it all depends on where the fat is located. There are people who are really thin that have a lot of subcutaneous fat, and there are people who have a higher BMI who don't have much subcutaneous fat or fat directly underneath the skin. So a consult is used to best determine. But in my experience, don't just gain weight on your own because you're planning to have surgery unless your surgeon that you've chosen specifically tells you to. Even with that said, I see a lot of people telling patients to gain 25, 30 pounds. To me, that is unacceptable and not healthy. I've seen patients get heart disease and have to go on blood pressure medications. Particularly, one patient was told to gain 25 pounds by someone else, and now she's on 2 blood pressure medications that she can't get off of. So in general, I don't encourage a lot of preoperative weight gain unless I've specifically asked for it. Even then, I'm only going to ask for maybe 5 pounds, 10 ever at the most. That's rib lux. You hear it, you see it, you feel it. So all done with a big combo case. So I did Lipo 400 with a BBL, a silicone breast augmentation, and my signature rib lux anterior and posterior rib remodeling. Had a very petite patient today with a BMI of 18. I also lipoed her arms just to make sure we had enough fat. So we were able to get enough fat to give her some fullness and roundness to her buttocks overall. Lots of swelling, but that'll eventually go down. Did the rib remodeling to really bring in that waist, and really did some nice contouring, which is really going to help take that boxy shape into more of a foxy shape.